Hi, how are you? I heard you had a really rough New Year's. Yes, so we have you in here for severe dehydration, low potassium and vitamin B levels. Okay, and elevated heart rate. So you've been sleeping and we've been just giving you IV fluids. Do you remember any of this? Okay, alright, great. So what I'm going to do is just do a head-to-toe checkup to see if you are in a state where you can actually go home. Alright, how are you feeling? Okay, still have that headache. Alright, on a scale of 1 to 10, how would you rate your pain? Okay, about a 7. Sorry to hear that. Can you verify your first and last name? Great, and your date of birth? Okay. Any family history of heart problems? Heart murmurs or palpitations? Okay, so your problems are stemming from the festivities of New Year's Eve, so I'm going to go ahead and write down that it's likely that you are going to be right as rain. Alright? Are you on any special diets? Okay, alright. Any family history of hypertension or blood disorders? Okay, do you take medications on a daily basis? Alright, yeah, I do see we have you here for Lexapro. Okay, and trazodone. How is that trazodone working out for you? Oh, that's really good. Alright. So, anything else that I should know about your lifestyle or any other pains that you've been having throughout the last few months? Great, okay. Well, I'm going to go ahead and just start by palpating your head and taking your vitals, and we'll be doing a cranial nerve exam just to make sure that your neurological functions are all proper and that you are just doing well cognitively. And then I'll move on to your abdomen and feet. Do you have any questions? All right, great. I'm Nurse Katie, by the way. All right. Okay, I'm going to start by listening to your heart and lungs, so you can just breathe normally for me for now. Okay. Okay. Alright, so it feels slightly elevated. I'm going to listen on the bell side for murmurs. Okay. S1 and S2 are present, no S3. Okay. I'm going to write down that your heart rate is still at 90 beats per minute, which is quite high. So we're going to continue to monitor that. Okay. Alright, I'm going to listen to your breathing now, so why don't you go ahead and take some deep breaths for me. In, 2, 3, and out, 2, 3. Good. In, 2, 3, and relax, 2, 3. Alright, great. Let's do the other side. In, 2, 3, out, 2, 3, and in, 2, 3, out. Okay. Alright. That sounds normal. I'm going to go ahead and take your blood pressure now. So I'm going to go ahead and use this arm if that's okay. Great. So I'm going to slide this up. Excellent. Okay. Are you comfortable there? All right. Your blood pressure is elevated, 130/90. Okay, but it has improved since the last time we checked. I don't think you were awake for that, but it's going in the right direction, but it's still a little more elevated than what we'd like to see. So, but progress is good. I'm going to take your temperature. Okay. That is 98.4, so you're good. Great, okay. So, when you were admitted a few days ago, you did have a slight bump in the head. Do you remember falling? Okay, I didn't think so. I'm going to go ahead and palpate to make sure that it's calmed down. I'll be taking some measurements and just checking for any excess swelling or edema. Okay, so I'm coming a little closer. Okay. Oh. Okay, I do feel it is on that left side. Alright, it feels a little bit better. I'm going to take a measurement though. Wow, okay. So it's gone down by 1.5 centimeters, so that's excellent. Alright. I'm going to be pressing down on it gently. Does that hurt to touch? Okay. It just feels very tender. Okay. Alright, I'm just going to be feeling along down the head and the mastoid bone. Sometimes when you have a concussion, it doesn't show up until a few days later. So that's why I'm just checking to see if anything has popped up. Okay. Any pain? Alright, excellent. So if you don't mind, I'd like to sit down and continue to palpate your face, and then I'll be doing some neurological tests, but may I sit down at your bedside? Thank you very much. Alright, so I'm going to be palpating your face now. Just hold still. Very good. Okay. And let me know if you feel any sudden pain or tenderness, or if there's an area that's very sore, yes. Okay. And I feel your lymph nodes. Non-palpable. Your irregulars. Okay. Okay, just hold still for me. Alright, no edema. I'm going to make sure, I'm just going to do a few measurements of the face just to check for symmetry. You don't have to do anything, just relax. It's 3 inches. On either side. From the nose to the ear. Okay. Going a little bit below normal. It's 2.5 centimeters. Okay. Alright. Very good. I'm just going to go up to your forehead. Okay. Okay. Okay, that's 4 for the cheeks. The cheeks up the nose to the ear. Okay, I think I pretty much have what I need. Okay. Okay, sorry, you just got a little something right here in your cheek. Hold still. I don't know what that is. Okay. Are you experiencing any numbness? Alright, good to know. I'm just going to do a few quick tests to make sure. So I'm going to do a little tickle on your face right now. Do you feel this? Soft? Okay. So when you feel the sensation, I'm going to do a series of tests. Say dull, and this will be sharp. Do you feel the difference? Okay, go ahead and close your eyes and let me know if it's sharp or dull. And tell me what side of your face you feel it on. Okay? Okay. Okay. Okay, and which side? Okay. Very good, okay. So I'm going to take the dull tool and start in your forehead and bring it down to your chin. I want you to let me know if you feel the same sensation the whole way or if there's a point where you don't feel anything, okay? Good, okay. We're going to do the same thing ear to ear. Excellent. Okay. So next we're going to check your sensation of temperature. This is a cold sensation. Do you feel that it's cold? Good. And then this is going to be warm. It's really neutral, so you can say neutral, but cold or warm. Okay, so you feel the difference. Okay, good. Go ahead and close your eyes again. Good. Yes. Okay. All right. And look at the musculature of your face to make sure that you're having good mobility there. So if you could make a big wide face for me with your eyes. Okay, raise your eyebrows, open your mouth. All right, now squeeze into a tiny little ball. Tight, tight, tight. Very good. All right, any problems doing that? Could you smile for me? Frown. Okay, good. Now leave your eyebrows right there where they are. Okay, and go ahead and attempt to raise them when I tell you to. I'm going to put my fingers right above them just to prevent your push, okay? 3, 2, 1. Good, good. Now go ahead and raise them and try to lower them in 3, 2, 1. Excellent. Okay, we're going to just test your cheek now. So I'm going to put my hand on the side of your cheek and try to turn your head this way. 3, 2, 1. Good. Let's do the other side. 3, 2, 1. All right. Now I want you to try to look up at the ceiling for me. And I'm going to put my hand right here on your chin. 3, 2, 1. Good. All right. Now try to chin to your chest. And I'm going to be putting my hand right here. 3, 2, 1. Bravissimo. Okay. Okay. Pleased with that? I'm going to go ahead and check your eyes and your ears. Okay. All right. Coming a little bit closer. Okay, I'm going to just be looking inside your eyes. Look straight ahead for me. It's going to feel a little bright. Just need to make sure that your pupils are showing me normal, round, and reactive signs. Okay, hold still, okay? Good. All right. Okay. see a bit of redness. Okay, but I don't see any irritation that would indicate infection, so it just looks like you have some dry eyes. And that might be a symptom of your medication that you're taking. It might cause dry eyes. I'd have to check. Did you take your Lexapro today? Okay. Alright, well I'm going to give you some eye drops here in a bit, but I'm going to look at the other eye. Otherwise they look completely healthy. Okay. Alright. No jaundice, so it looks like. Okay. Looks like your liver has survived. Very good. I do have an eye drop right here I'm going to go ahead and give to you. Okay. Alright, I'm just going to put it right here. Okay, into your other eye. Okay, that should feel better. Good, okay. Excellent. Have you had any problems with vision aside from the dryness? Okay, when was your last eye exam? Okay, so you should be good. I'm going to test just your range of motion and make sure that you're focusing correctly. So go ahead and look at this light here. Do you see it? Okay, go ahead and follow it. And keep your head straight for me. Good. Alright, now follow my fingers. Let's switch. Follow these fingers right here. Okay, very good. I want you to say, when my fingers enter your field of vision, go ahead and say now, okay? Alright, now can you tell me which fingers are moving? The fingers on your left or your right? Okay, so these will be your left, okay? And this is your right. Okay. Good. Okay, good. And are those fingers closer or further away from these? Good. Are these closer or further away? These. Very, very good. So, this is a Snellen chart. I'm sure you've seen this one before. I'm just going to have you read a few lines of letters. So let's start from the O to the F. Can you go ahead and read that? Good. Let's go down. E to the O. And what about this last one? Very good. Looks like you have 20/20 vision. I'm just going to check for farsightedness. Can you read this letter right here? Okay, can you read this letter? Good. Can you read this letter? Yes. What color is this? Perfect. And what color is this? Great. And which circle is larger, 8 or 5? Okay. 5 or 3? 4 or 5? That one's a little tricky. Yes. Very good. Okay. So your eyes are healthy. I have no issues there except I'm going to prescribe some medical drops for you. The ones I just put in. They're prescription only, but I can write you a script. Alright. I'm looking at your ears now. So if you could turn your head this way, I'm just going to peek inside. Very good. Your tympanic membrane looks like a healthy pearl gray, but I wish I could see more of it. You have a lot of wax buildup. So just something to keep in mind. Otherwise, I don't see any irritation or infection. Okay, how's your hearing? It's always been pretty good. Okay, go ahead and turn your head that way. Okay. Same here. Just clean out the wax and you'll be able to hear better. Okay. I'm going to make some rustling sounds with my hands on either side of your ear. Let me know if you hear it in the right or the left ear. Good. right. Very, very good. Okay. This is a tuning fork. Do you hear the sound? All right, go ahead and close your eyes. I'm going to be making this sound in a series of times. And let me know when the sound stops, okay? All right. Good. Good. Yes. Good. And which is louder? I'm going to give you two options, position 1 or position 2. Here's 1. Here's 2. 1. Good. Here's 1. Here's 2. 2. 1. 2. Very, very good. Okay, I'm pleased with that. Okay, I'm going to whisper some things in your ear. Just repeat the words that you hear after me, okay? Forest, trees, baby, bathwater, winter, snow, joy, soy. Okay. All right, very good. I'm going to be judging your perception to resonance chamber. So this is another neurological test, kind of similar to the sharpened dull, except this time I'm going to be placing a vibrational sensation right here and different points of the face. Let me know when the feeling stops. You're going to feel kind of a vibrating sensation, okay? So when I stop the sensation, go ahead and say now. Right. Mm-hmm. Okay. Good. Okay. So far, you're doing great. I'm going to test your taste and your smell. I know that given the experience that you went through, sometimes it takes a while for the salivary glands to regulate themselves and get back to normal. So you might have a hard time with taste, but your smell should be okay. All right, well, let's go ahead and see. Let's start with taste. So close your eyes and stick out your tongue for me. Thank you. All right, what does this taste like? Sugar. Okay, can you get more specific than that? Okay, that was cinnamon. I mean, you were on the right track, but it sounds like you haven't completely gained back your taste yet. Okay, let's try another one. Okay. Citrus. Good. Can you tell me what kind of citrus? Close. It was lemon, not orange. All right. I'll have you smell a couple things now. Okay. So this is an aroma, and it's pretty common. Go ahead and inhale. Close your eyes. Lavender, yes. And we're going to do one more. Vanilla. Very good. Very pleased with that. Okay, it sounds like your comfort animal has arisen. Okay. So now you're on an IV fluid now, and our hope is to get you off and get you back on just regular water in the next couple hours. How do you feel about that? Okay, how's your nausea? Okay, because we've been decreasing the nausea medication in increments, so you're barely on any right now. You feeling good? Okay, that's good to hear. So I'm going to palpate your chest and go ahead and look at your stomach and make sure that all your organs are just doing well. So let me know if you feel any pain. I'm just going to be pressing on your chest. Any pain? Okay. Alright, I don't feel any protrusions. I'm going to palpate your lymph nodes underneath your armpit, so it's going to feel a little strange. I'm sorry if it tickles. Sorry if they get in there. Sorry. Non-palpable, so that's very good. Okay. So with your permission, I'm going to lift the blanket and just take a look at your stomach and how it's doing right now. I'm going to listen for regurgitation sounds and palpate and feel your liver, your spleen, and also your thyroids on your hips, okay? So I'm going to start just by palpating. Okay? If I let her on the ground, she'll start barking. So this is what we have. So sorry, but I consider it an enhancement of your exam. She's helping in some way. We don't know. Okay. Your liver is normal. I'm going to feel your glands, your lymphs here. Very, very good. Okay. Just going to be feeling more. Okay. Okay. Any pain there? Okay, so still a little tender. Well, your organs feel normal sized, so that's good. Okay. Sorry, I had to go a little deeper for this one. Very good. Okay. All right, I'm going to take a listen now. You don't have to breathe deeply, just relax. You can close your eyes, breathe normally. Okay. I'm hearing some irritation still. It's definitely gotten better, but your stomach's still a little bit tender from your experience. Not to worry though. I don't hear anything alarming. It's just something that we're going to keep checking for sure. I want to test your tummy sensation to warm and cold right now. So do you feel this as a cold sensation? Okay, and this is warm. Good. Go ahead and say cold or warm. Yes. Yes. Okay. Right. Cold or warm? Good. Okay, good. I'm going to tap this cold instrument on your stomach 1, 2, or 3 times. So say 1, 2, or 3, depending on how many times you felt it. Good. 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 Excellent. All right. Very good. So our comfrey animal has found her perching spot. Okay. I'm going to do a sharp or dull test now. So let me know if you feel a dull sensation in your stomach or a sharp one. You don't have to get this perfect because it's a little bit more difficult. But I just want to gauge your general ability. Sharp or dull. Good. Sorry, I poked you a little bit. I didn't mean to do that. Good. Yes. Okay. Okay, that was pretty good. I'm just going to tuck you back in here. Okay. Okay, all sounds are very healthy. All right. I'm going to move on just to your legs and your feet. Pain here. Here. Okay. Right here. Good. All right. Just going to be doing some measurements just to check for edema. Okay, sounding symmetric, or it looks symmetric to me. Looking symmetric. Okay. All right. All right, and looking at your, okay. And looking at your feet, I'm going to squeeze your left or your right foot. Tell me which one that you felt. Good. Mm-hmm. Good. Good. I'm going to test your Rubinski response as well. Okay. Excellent. Okay. All right. So we're going to do sharp and dull on your feet again. This is sharp. Do you feel it? Good. This is dull. So say sharp or dull. Mm-hmm. Good. Okay, and do you feel a sensation on the pads or the heels of your feet? Good. Yes. Good. Okay, I'm going to look at your capillary refill to make sure your circulation is doing well. Okay, 2.5 second capillary refill. Are you cold? Okay. I know I asked you that before, but alright, so circulation could use some improvement. It's not in the danger zone, but I'd like to see you circulating your blood in a quicker manner. So I think that concludes our exam. Okay, so I want to thank you for allowing me to do this exam. You've shown some vast signs of improvement, so I'm really happy to say that. However, we're not ready to discharge you. As of now, we're going to wait a few more hours just to check on your levels of dehydration and just make sure that everything is improving at a better rate, okay? Alright, because you did say that your pain was at about a 7, so we want to get it down to a 2 or a 3. We want to make sure that your potassium levels are where they should be, and that's going to take a couple more hours of IV fluids. I'm sorry to say that. So do you have any questions? Okay. Alright, great. Well, dinner is in about 30 minutes, so they'll be bringing that in. Let me know if you need anything else. Just go ahead and ring the buzzer. Alright, so I hope you rest up and feel better soon, okay? Alright, bye.